Go ahead.
How's it going? Dr. J with Thrivespine Center, and today I wanted to cover the importance of the nerve system, and I wanted to use a perfect example. As you know, as a chiropractor, we deal with people's nerve systems all the time. So I like to ask this question in my healthcare class: how many of you know who Christopher Reeves is, right? Superman, right? So how did Christopher Reeves go from a 6'4", 204-pound stud to this in just 4 short years? What happened to him, right? He fell off his horse, and when he did, he hit his head in such a way that it fractured these top 2 bones right here. In fact, they shifted right up against his brainstem. See, a lot of people think he severed his spinal cord at the time of his injury, but he didn't. All he did was bruise his spinal cord. In fact, his spinal surgeon said that the amount of damage he caused to his spinal cord in that area was smaller than a pencil eraser. That's less than half a centimeter's worth of damage. That's about enough damage to take up the very tip of my pinky finger right there. Yet instantaneously, what happened to him? He became a full-blown quadriplegic. His legs didn't work anymore, his arms didn't work anymore, his back muscles didn't even work anymore. That's why he had this contraption just to hold his head upright, because his neck muscles can no longer support the weight of his head. So was there anything wrong with his muscles at the time of the injury? No, because he didn't have a muscle problem, right? He had a spine problem, right? So evidently, you can have a severe skeletal muscular problem by a minor but major spinal cord injury. But that's not all that happened to him, because what's this tube-like thing he had right here in his throat? Well, that's called a trach tube. So his lungs can no longer breathe and function on their own, so they had to put him on an artificial breathing apparatus called a respirator to breathe for him. Now, was there anything wrong with his lungs at the time of the injury? No, because he didn't have a lung problem, right? He had a spine problem. They had to put a pacemaker to control his heart, because his heart wanted to beat to the rhythm of its own drummer. So they had to put a pacemaker to artificially beat his heart normally for him. Was there anything wrong with his heart at the time of the injury? No, because he didn't have a heart problem, right? He had a spine problem, okay? And the list goes on and on. They had to put feeding tubes into him because his digestive organs shut down. So they put feeding tubes into him to directly put food and nutrients directly right into his digestive system. And within 4 short years after his injury, he went from here to here. What does it look like he has there? Well, it almost looks like he's a stage 4 cancer victim, despite the fact that they were feeding him the best nutrients that money can pay for. But because his nerve system wasn't telling his digestive system quite what to do, it couldn't assimilate all the nutrients from the food. So over time, he became nutrient deficient, right? He had a colostomy bag because his bowel shut down. He had a catheter because his bladder completely shut down. He lost the ability to control his bladder. So here was a guy who went from a 6'4", 204-pound stud who played one of the most infamous superheroes of all time to this in just 4 short years because of one minor but major spinal cord injury. And here's the thing. Do you know what he died from? He actually died from a simple staph infection from one of his PICC lines on his IV, right? Now, we all have that same staph bacteria on our skin, but because his immune system was so run down, he died of a very simple infection. What system controls all the systems in your body, including your immune system for that matter? It's your nerve system that tells every system in your body how to coordinate, how to function, how to control the different aspects of your body, right? So here's what I really want you to get from this. Whether it takes a fall off a horse or 34 years worth of damage to your spine, the end result is exactly the same. The only difference in Christopher Reeves is when he had his injury, all the bulbs shut off at once, right? So all the bulbs shut off at once. So instantly they knew where to look. But most people we see in our office, they come in with years and years worth of spinal degeneration and decay. They're on all these medications, and it's as if their life light was turned fully down. It's as if they had a dimmer switch on their back, and that dimmer switch had been turned fully down. So the goal in our office for each and every patient that comes in here is to get them from this to this. It's to remove the neurological interference so that they can function at their full potential. So hopefully that makes sense. That's my message for today. I'm Dr. Jason with Thrivespine Center, and remember, it's aligned to thrive, okay? And if you have any questions, you can email us at thrivespincenter@gmail.com or call our office at 916-587-1276. Have an awesome day.